Hello, I'm Dr. Beech. In today's video, I want to talk about Ayurvedic pulse diagnosis. And patients ask me this question sometimes: what is it we actually do when we see the pulse? Pulse diagnosis is the traditional means of diagnosing our patients in Ayurveda. The way that it's done is with these 3 fingers on the pulse, feeling. You'll find that when I take pulse, usually I'm taking on both sides at the same time. And the purpose of pulse diagnosis is that it allows the practitioner to actually see within the pulse all the different levels of the physiology. We can feel the organs, the different tissues in the body, how the tissues and different systems, organs of the body are interacting with each other, where toxins are accumulating, what organ, what tissue, what kinds of toxins are accumulating, and how they might be affecting and interacting with each other in such a way as to produce a particular symptom in a patient. So the issue here is that when patients come in to see us, they come in usually with a symptom, because that's our feedback that our body's giving us that something's wrong. But I may have 5 different patients with, say, a cold, and there may be 5 different sets of circumstances that are actually creating the conditions or allow that cold to occur. How am I going to know, just by talking to the patient, what those different imbalances, what those toxins are, where they've accumulated, what tissues they're in, how that's actually affecting the interaction of that organ or tissue with another organ that's giving rise to that ability or that weakness in the system for a cold to come up? There's no way to know. So I would have to treat those 5 patients with a cold in exactly the same way based upon their symptoms. However, when I can see the pulse, that gives me the ability to see the individual imbalances that are accumulating in that system, where the toxins are, what's occurring that is creating that cold. Now, I'll give you an example. So maybe a patient comes in with, say, digestive issues. Maybe they have gas and bloating, constipation, or something like that. Well, that could be caused by, typically that would be caused maybe by poor diet, lack of probiotics. That's the logical kind of conclusion that one would make, and maybe we'd start looking at the diet and all of that. But I could take that patient's pulse, and I may find that their constipation is coming from, say, their emotions. Maybe their emotions are creating or stimulating enough their physiology that it's inflaming the liver, giving the liver too much stimulation. And as a result of that, the liver's then dumping acidic toxins into the bile and into the gut. And as a result of that, that's drying the gut because of the inflammation in the gut. And that drying that occurs is creating the constipation. So if I treat the constipation as a digestive issue, in that case, I'll only get, I may get some results, but I won't get a complete result because I'm not really looking at the actual, what's called etiological factor. In Ayurveda, we call it the hetu, the etiological factor. In this case, this patient, maybe they've had some emotional strain or trauma, or who knows, it could be so many different things, but that it's creating some stress here that's actually coming out in their system as constipation. Maybe in another situation, for another patient, it might come out as some other kind of problem, maybe headaches or maybe a skin problem. Who knows? Anything can happen. So what we do is see the pulse so that we can individually assess each patient according to what their imbalances are, and as a result of that, then design an individual program for that patient that actually treats those imbalances as opposed to merely treating the symptom. And that's one of the reasons that this Ayurvedic approach is so effective for so many different kinds of conditions, because it is individualized and it is focusing specifically on that problem for that patient. So I just want to go over that and clear that up for everybody so they'd understand what it is that we're doing when we see the pulse. So thank you.